Hello and welcome to this introductory presentation and overview of standards in healthcare and medical informatics on behalf of the Karolinska team in the CUREX project. My name is Panos Papachristou. I am a medical doctor and researcher at Karolinska Institutet. Karolinska Institutet is a full beneficiary partner and part of the CUREX project funded under the Horizon 2020 Research and Innovation Program. This presentation is part of an online lecture series under the CUREX project. This presentation will go through an example from healthcare, following the definition of standards and history of standardization. I will present some core standardization needs in healthcare and the standardization bodies. Further, I will inform about standards in health informatics and standards in information security, as well as different levels of interoperability in healthcare and interoperability challenges. With this presentation, we want to increase your understanding about what defines a standard, the benefits in healthcare, but also what needs and challenges in interoperability lie ahead. Let's start by looking at an example from healthcare. In healthcare, working in an environment with ever-increasing utilization of information technology, we are surrounded by different standards, not even knowing it, from the electrical supply to all the electronic devices, to the authentication and transmission of data, to the different health information systems of each healthcare organization. For medical professionals, however, working in information silos has not benefited their work and foremost, not the healthcare provision and experience of their patients. Still, there are many areas in Sweden where the different health information systems from hospitals and primary care centers do not exchange healthcare information in a direct, interconnected manner, making it difficult to monitor efficiently the patient's transition from different healthcare levels, for example admission to a hospital or a referral for follow-up in primary care. Many times, poorly written referrals are sent by conventional post or fax, and the health information then needs to be manually retrieved and transferred to the facility's health information system. This incompatibility of systems not only is inefficient, but may put patients at risk when important healthcare information can accidentally be missed or overlooked. A standard is a repeatable, harmonized, agreed and documented way of doing something. Standards contain technical specifications or other precise criteria designed to be used consistently as a rule, guideline, or definition. In fact, standards help to make the life simpler and increase the reliability and the effectiveness of many of the goods and services that we use. Below are two examples that are results of standardization, the plastic bank card and the Euro palette. Standards result from collective work by experts in a field and provide a consensus at the time when the standards are developed. As standards in the international arena are established on a consensus and broad stakeholder basis, they represent what can be agreed upon. A published standard is therefore the harmonized synthesis of what the group is prepared to publish. In terms of international and regional standardization, this is even more important than at the national level. The importance of consensus is critical because of large and diverse stakeholder groups and needs. Ultimately, this means that a standard might lack some of the clarity, detailed, and specific criteria certain stakeholder groups or individuals would have preferred. Standards do not necessarily have to be developed by a standardization body such as ISO or IEC. Any organization can establish standards for international or external use. However, to be truly called a standard, the requirements stated above must be met. Adherence to standards is voluntary, unless they are a requirement of legislation or regulation, or are incorporated as part of a formal contract. In order to increase global tradability and compatibility of products and services, it is important that, whenever possible, standards are harmonized globally to ensure they are truly transboundary. Standards are an important aspect of ensuring that products and services are delivered in a harmonized and consistent way, while providing consumers and users with the confidence that whatever products and services they are using deliver to specification. Many of the standards identified provide this support by ensuring that, for example, the characteristics of a particular component are measured, calculated, or evaluated in a consistent way. Typically, these may be the determination of chemical and physical properties. You may ask yourself why we need standards. Well, consumers expect that services and products will be consistent in quality, durability, and ease of use. So international standards are rules and guidelines that help to ensure a safer and healthier, more environmentally sound product or service. Products with improved quality and reliability. Also, better operational compatibility between products and greater consistency in the delivery of services. There is also an improved choice and access to different goods and services, and a standardized production and supply chain results in lower costs for consumers. In total, there is better product and service information provided with standards both to producers and consumers. Standardization is as old as interactions within larger human communities, seen, for example, in archaeological findings of weights and measures. The first Chinese emperor, Qin Shi Huang, standardized not only the Chinese characters but also the system of units and measurements, as well as the currency and the width of cart axles. War has often driven standardization. More than 2,500 years ago, Heraclitus stated, "War is the father and king of all." In the American Civil War, one of the reasons for the Union's victory against the South was the standardization of its rail tracks. Another example, during wars, was standardized rifle parts, making rifle parts interchangeable between guns. There are also civil examples of standardization benefits. In 1904, a fire broke out in Baltimore. Reinforcements from New York, Philadelphia, and Washington, D.C. came to Baltimore to combat the flames. However, after they arrived, they realized that their fire hoses could not be connected to the fire hydrants. With the lessons learned, the US started many standardization projects. In 1904, the ANSI, American National Standards Institute, was established. A few years earlier, the British Standardization Institute, BSI, had been founded as well. All standards are not created equal. One can therefore divide standards according to usage in de facto, de jure, and voluntary standards. De facto standards are those which have been accepted as the best standard for their purpose. They have evolved to be accepted because of a wide public support and market forces. This is often because they have a proven track record for efficiency and reliability. De facto standards, which become accepted, by an industry are also known as industry standards or professional standards. Anyone can attempt to create a standard if they wish. You could try to invent a new audio file format to try to rival AAC and MP3, or invent a new internet markup language to replace HTML. However, it would not necessarily become de facto unless it gained popularity. On the other side, de jure standard are those standards which have been approved by formal authorities like the IEEE or the ISO. These standards are critically assessed before being approved. An example of de jure standard is the ASCII character set, or some other hardware standards include USB, FireWire, and HDMI. Finally, voluntary standards or private standards are standards developed by non-governmental entities such as businesses, not-for-profit organizations, or initiatives involving multiple stakeholders. Some examples of voluntary standards are Fair Trade, Organic, Rainforest Alliance. Contrary to governmental standards, which can be either mandatory or voluntary, private standards are voluntary by definition. As such, compliance to these standards is not legally required by national governments or multilateral regulations. Therefore, these standards fall outside of the World Trade Organization framework. Standardization is a commonly misunderstood term in the healthcare industry and can take on a negative connotation as a cookie-cutter approach. For healthcare leaders looking for a competitive advantage, standardization represents efficiency. Standardization helps decrease variation, which increases quality and safety while reducing costs. From a healthcare manager's perspective, standardization helps foster an environment of quality patient care. Standardization, especially in healthcare, minimizes the risks of errors, increases patient safety, and can actually improve the patient experience. On the other hand, for physicians and other healthcare providers, standardization can mean something entirely different. Standardization is often viewed negatively and as a means of control. Many physicians are not comfortable embracing standardization unless there is demonstrated evidence it benefits patient outcomes. Nurses, on the other hand, believe standardization is about cost savings, efficiency, and patient safety. Nurses often see standardization as a time saver. The less time they spend searching for the proper medical equipment, the more time they can spend with the patient. Subsequently, patients believe that standardization is for their benefit, but they are typically more focused on the manner they are treated rather than the methods used to treat them. There are several standardization bodies that coordinate and manage the drafting and publishing of different standards in many product and service areas. They operate on different levels from international, continental to national levels. On an international level, we have the International Organization for Standardization, ISO, whose 163 members are recognized authorities and standards, with each one representing one country. Members meet annually at the General Assembly to discuss the ISO strategic objectives. There are over 250 technical committees and thousands of subcommittees, working groups, and task forces. On a continental level, we have CEN and ETSI, for example. CEN, the European Committee for Standardization, is an association that brings together the national standardization bodies of 35 European countries. CEN is active in multiple sectors like chemistry, energy, environment, food, healthcare, information society, and security and defense services. ETSI is the European Telecommunication Standards Institute, and it produces globally applicable standards for information and communication technology. The Swedish Institute for Standards is an example of a national standardization body. And other examples are Health Level 7, which is a non-profit organization dedicated to providing a comprehensive framework and related standards for the exchange, integration, sharing and retrieval of electronic health information. Health informatics standards help to ensure that health-specific applications used by clinicians, patients and citizens are safe, usable and fit for purpose. They support interoperability between systems so that information communicated electronically can be accurately interpreted and used for decision-making, continuity of care and other purposes. The ISO TC 215 is the global digital health and informatics standards body, leading the way for coherent and consistent exchange and use of health data, information and knowledge to support and enable all aspects of the health system. With ISO representing over 160 countries and Technical Committee 215 having 61 participating and observing countries, it plays a vital international role in enabling the global reach of health information systems to collect information, exchange it seamlessly, and protect its security and privacy, while making it widely available for authorized access by many potential users, including patients and those who care for them, such as researchers, regulators, funders, and payers. The ISO Technical Committee 215 consists of several working groups, each dealing with an aspect of electronic health records. Next, we're going to talk about standards in information security. So, what is the ISO 27001? As the risks associated with cyber attacks and data breaches continue to increase, information security has become a critical issue for every business or organization, including healthcare. The ISO 27001 is the international standard for information security. It sets out the specification for an information security management system, or ISMS. The Information Security Management System Standards best practice approach helps organizations manage their information security by addressing people, processes, and technology. A certification to the ISO 27001 standard is recognized worldwide as an indication that the ISMS is aligned with information security best practice. Part of the ISO 27000 series of information security standards, ISO 27001, is a framework that helps organizations establish, implement, operate, monitor, review, maintain, and continually improve an ISMS. The Information Security Management System can help organizations comply with a host of laws, such as the General Data Protection Regulation, known as the GDPR, and the Network and Information Systems Regulation, NIS regulations. ISO 27001 focuses on protecting three key aspects of information: confidentiality, integrity, and availability. By confidentiality, we mean that information is protected and unavailable and not disclosed to unauthorized people, entities, or processes. By integrity, we mean that the information is complete and accurate and is protected from corruption. Availability means that information is accessible and usable as and when authorized users require it. Now, let's talk a little bit about why interoperability in healthcare is important. So, health data has always been challenging to access and share in a secure manner. The nature of health data creates a paradox. It's difficult to share because it's sensitive and requires a high level of privacy and security. Yet, the inability to access it when it's needed has potential to cause significant harm. A lack of interoperability can result in an incomplete understanding of an individual's or population's health needs, which can lead to poorer outcomes and higher costs. As populations around the world age and people live longer, interoperability and data sharing are going to become increasingly critical for delivering effective healthcare. In the US, for example, the Agency for Healthcare Research and Quality has estimated that 2 out of 3 older Americans have at least 2 chronic behavioral or physical conditions. The treatment for people with multiple chronic conditions currently accounts for an estimated 2/3 of the US healthcare costs. In their nationwide roadmap, the Office of the National Coordinator for Health Information Technology, ONC, says that use of electronic health records has dramatically increased in the United States. Many hospitals now have routine access to medical records and patient data from outside providers, yet less than half of hospitals are integrating the data they receive into individual patient records. So, although access to vital clinical data has improved, there's still a lot of work that needs to be done to bring stakeholders together and to create an integrated data ecosystem. In addition to helping physicians and other healthcare providers see a more complete view of their patients, health data interoperability helps organizations across the healthcare industry. If health information systems were more integrated, then health plans would be able to develop a better understanding of their utilization rates and demands for service. Government service providers would be able to access population data to see trends and meet their citizens' needs. Also, life science organizations would be able to leverage robust data sets to drive faster and more informed research. So to sum up, with better interoperability in healthcare, organizations would be able to stop regarding individuals as a patient one day, a health plan member the next day, and a consumer of health data apps the third day. So instead, decision makers across the industry would be able to start looking at how people access and use health information, regardless of its source, to drive better models of care, to pursue better patient safety, and improve experiences for the people they serve. Healthcare records are increasingly becoming digitized. As patients move around the healthcare ecosystem, their electronic health records must be available, discoverable, and understandable. Further, to support automated clinical decision support and other machine-based processing, the data must also be structured and standardized. So for this, a new standard was developed by the standardization organization Health Level 7 International, called Fast Healthcare Interoperability Resource, or FHIR. FHIR was created with the complexity of healthcare data in mind and took a modern internet-based approach to connecting different discrete elements. FHIR was created to make it easier for healthcare data to move from one system to another. Its development began in 2012 in response to market needs for faster, easier, and better methods to exchange the rapidly growing amount of health data. So, how does FHIR work and what is a FHIR resource? FHIR organizes data into resources like patients, conditions, medications, and provides a standardized structure for how that data is organized and interpreted by different computer systems or applications. A FHIR resource can be an individual packet of information that includes metadata, text, or particular data elements, but can also be bundled into collections that create clinical documents. FHIR resources can be used to build documents that represent a composition, a set of coherent information that is a statement of healthcare information, particularly including clinical observations and services. So by creating an accessible and standard URL for these information bundles, instead of just passing individual documents back and forth between systems, a number of different applications can point to the same version of the same data each and every time. Interoperability for healthcare has 4 different levels that have been defined by informatics experts and the Healthcare Information and Management Systems Society. Some of these levels can be achieved today with existing healthcare IT architecture and IT systems, while others will require innovations and additional developments in patient-centered technology. The 4 levels include foundational, structural, semantic, and organizational levels of interoperability. The foundational level of interoperability, also known as simple transport, is the most basic one. Data is securely transferred from one system or device to another without interpreting the data or transforming it into a particular format. For example, a nurse downloads a PDF file of a patient's latest lab results from the lab's results portal, then manually enters the data into the patient's health record. When structural interoperability or structured transport is achieved, all the data is standardized to a particular format, so it can be interpreted by multiple systems or devices. This data is organized in a particular order, so the receiving system can automatically detect specific data fields. Data standards like FHIR and Health Level 7 provide structural interoperability so records can be consistent, centralized, and easy to move between systems. The semantic level of interoperability, or semantic transport, involves exchanging data between systems with completely different data structures. Imaging systems provide a simple example. There are many specialized DICOM and non-DICOM formats for images. With semantic interoperability, images could be transferred from one system to another, interpreted and incorporated into the new system regardless of the image's original format or source. Yet, determining what data to collect and transfer can be difficult, since systems have different ways of presenting the same information. For that reason, some experts argue artificial intelligence will be needed to achieve full semantic interoperability. Finally, organizational interoperability involves the seamless exchange of data between various organizations with different requirements, regulations, and goals. To achieve this level of interoperability, there must be policy and governance innovations, as well as technological innovations to ensure consent, security, and integrated workflows move smoothly between different groups. Though some experts say semantic is the highest level of interoperability, others say it is organizational interoperability. Let's talk about some challenges of interoperability in healthcare. While many healthcare experts and leaders agree that better interoperability would improve healthcare overall, there are common challenges that healthcare organizations tend to face as they work on making their data and their systems more interoperable. Let's explore some of those challenges and how organizations can overcome them. Disjointed coordination. Improving interoperability requires strong coordination between different organizations, regulators, and leaders, as well as coordination within organizations. Regulators provide standards and rules for healthcare organizations to follow, but organizations that want to be proactive about interoperability should consider creating a dedicated interoperability strategy and make interoperability planning a priority. Limited budgets. So not all organizations have the financial or technical resources they need to invest in the technical resources needed to build a truly interoperable system. There may be some government's grants available to update health record systems, so organizations should check to see if they are eligible. Many cloud vendors also offer pay-as-you-go payment models that could make technical expenses more affordable and predictable. Diverse technology needs. So organizations need to follow different rules and regulations depending on what type of care they provide and where they are located. So many organizations have highly customized data. Organizations can help connect different internal and external systems through a hybrid cloud platform that gives them options to combine and integrate the data without sacrificing the customizations they need. Legacy systems. Healthcare organizations with older legacy systems face the dual challenge of modernizing their systems while also meeting interoperability requirements. Organizations can meet both goals using a hybrid cloud approach to extract data from legacy systems and make it more accessible for modern applications and programs. This approach gives organizations the option to keep data moving while they work on updating their systems. What about health data exchange and interoperability? So, modern consumers of health data have high expectations when it comes to accessing information. Many now expect to have quick and continuous access to records about their health and their care. That's why many healthcare organizations are building health information exchanges, so-called HIEs, which are specialized networks that rely on interoperable systems to share electronic health information seamlessly and securely. Even though the adoption of electronic health records was a good first step towards building health information exchanges, there are still many challenges that need to be overcome to achieve the level of interoperability needed to obtain the full benefit of a health information exchange system. Some of these challenges are listed below. Lack of standardization. Although standard record formats like FHIR and Health Level 7 are becoming more common, and new regulations are pushing electronic health record vendors to provide applications that support interoperability, many providers and healthcare systems use customized electronic health record systems that can be hard to convert to a standard format and shared with others. Security. Healthcare organizations can find it hard to balance the need for health information to be accessible with the need to secure sensitive information and maintain patient privacy, especially with the increasing numbers of cybersecurity attacks on healthcare systems. Consent. By building digital health systems in which health information flows freely from provider to provider, it's not always clear when patient consent is needed and what level of consent is needed. Healthcare organizations are understandably cautious about this and tend to err on the side of not sharing information. Professional burdens. When new tools for record keeping are introduced, people need to learn how to use them. Healthcare professionals are often wary about new systems since electronic health record systems often do a better job supporting administrative and billing workflows than the actual clinician's needs. These challenges are not insurmountable. With advantages in cloud computing, especially hybrid cloud, it's become easier for organizations to move and secure data in a consistent way. Cloud environments provide opportunities for organizations to build data pipelines that standardize data to an industry standard format, like FHIR, and provide secure access to people who need it, whether they are payers, providers, or patients themselves. Coming back to our previous example from healthcare, nowadays in Sweden, there has been a successful implementation of a national patient overview, where a selection of critical information from the EHR is collected, partly through FHIR messaging standards. This information can be accessed, for example, by both hospital and primary care, regardless of their EHR system. The patient also has access to the information through another portal and can also communicate with the respective healthcare team through the website or through a mobile patient application. This indicated in the figure by the bilateral arrows. This availability of critical information provides better healthcare for patients and a safer and more efficient healthcare experience for both patients and the healthcare professionals. To summarize, this overview presentation of standards in healthcare talked about the definition of standards. That a standard consists of a technical specification or other precise criteria designed to be used as a rule or guideline that can be considered as a summary of best practice. We also presented some aspects of standardization in healthcare and its importance when it comes to increasing quality and safety for both patients and professionals, while reducing costs and improving the overall patient experience. Finally, the different levels of interoperability were presented, and the importance of interoperability of health data in health information systems was highlighted, with several challenges ahead that need to be addressed for an accurate, secure, and available ecosystem for health data exchange. Additional information can be found in the web pages of both national, continental, or international standardization bodies. Thank you for your attention. For more information about the CUREX project, visit our website.